Hi, my name is Ryan Dudinsky. I am in the RN-BSN program at the University of Akron. I'm going to perform the HEENT and abdominal exam for the RN assessment practicum. Hi, my name is Ryan. I'm going to do your assessment today.
Hi.
First, we're going to start with the HEENT exam. And your head appears to be normocephalic. Now I just got to check your hair and your scalp. Seems to be smooth and everything seems to be symmetric with no abnormalities found. Your hair is within normal limits, it's straight and shiny. It seems that you have normal protrusions of your forehead, parietal bones, and occipital bones in your mastoid process. And now I'm going to feel your temporal artery. And I'm going to have you open and close your mouth. And your temporomandibular joint seems to be okay. Any pain with that?
Nope.
And your facial structures appear to be within normal limits and symmetrical. Next, we're going to look at your neck. And we're going to see that your head is midline. Please touch your chin to your chest. And lift it back up. And your head is midline, erect, and still. And please turn your head to the right and to the left. And touch each ear to each shoulder. Don't lift your shoulders when you do it. Good. All these movements seem to be within normal limits, smooth and controlled. Now we're going to palpate your lymph nodes. And we're going to use a circular motion and use our finger pads to palpate. First, we're going to feel your preauricular lymph nodes in front of your ear. And then your postauricular lymph nodes behind your ears. And then your occipital lymph nodes in the back of your head. And your submental underneath your front chin. Some mandibular in the back of your jaw. And your superficial cervical is in your upper neck. And your deep cervical is in the sides of your neck. The posterior cervical in the back of your neck. And the supraclavicular in the lower neck. And there's no abnormalities with the lymph nodes, and there's no bulges or swelling. How is your sense of smell? Can you smell okay? Mm-hmm. Next, we're gonna test your vision with the Snellen chart and the Jaeger chart. First, we're going to do the Jaeger chart. And I'm going to have you read as low as you can on that, with about 14 inches away from your eyes.
Nine, 3, 7, 8, 2, 6.
You're supposed to cover one eye at a time.
Oh.
You're supposed to do one eye at a time.
Oh. Do I just do the numbers?
Yeah.
Okay. It's about 14 inches, right? 9, 3, 7, 8, 2, 6. 3, 7, 4, 2, 5, 8.
Okay, and your Jaeger chart tested, and you have 14 out of 14. And now we are going to do the Snellen chart. So I'm going to have you stand up. And we have a Snellen chart up there. We're going to have you go about 20 feet away. All right, now you're going to cover one eye at a time, and you're going to read the lowest line that you can.
F, E, C, F, D.
Perfect. And your other eye?
F, D, F, C, 2F.
It appears that your vision is 20/20, and now we're going to come back over here and sit on in the chair. And we are going to check your extraocular movements, your pupil size with the flashlight or a pen light, which I don't have. And we're going to do the 6 cardinal fields. So if you could just look right at me. and your pupils are equal and reactive. And the next thing we're going to do is check the 6 cardinal fields. If you could just look straight at my phone and go this way. Perfect. Now we are going to check your facial sensation and your muscles of mastication. Clench your teeth for me. Good, that seems good. And we are going to try and clench them again. And I can't separate her chin, so that's good. And close your eyes for me. Do you feel this?
Mm-hmm.
And how about this?
Mm-hmm.
Perfect. That was a cotton swab. Now I'm going to have you smile. And we're going to also have you frown. Puff your up like you're going to give a kiss. And puff out your cheeks. Perfect. Everything looks equal and reactive. Now we're going to do the whisper test for hearing. And I'm going to stand about 2 feet behind the patient. And we're going to have you I'm going to cover your one ear. We're going to test your left ear first. And I'm going to say 3 numbers and you should repeat them. 3, 2, 1.
3, 2, 1.
And we're going to check your other ear. 6, 7, 8.
6, 7, 8.
Perfect. Now we are going to check your gag reflex, cranial nerves 9 and 10. And we're going to use a tongue depressor, make sure your uvula is midline, moves symmetrical, and your palate's also. So can you stick your tongue out for me?
This part.
Might help if I had my flashlight. Stick your tongue out for me. Say ah.
Ah.
Everything looks equal and reactive. And stick your tongue out for me. Okay, good. Her gag reflex works. Next, I'm going to have you stick your tongue out. This is cranial nerve number 12. And it is no tremors, no deviation. It's midline. Say light, tight, dynamite.
Light, tight, dynamite.
Perfect. Next, we're going to have you try to lift your shoulders. Good. And we're going to have you try to tilt your head down to your shoulder. And same thing here. Perfect. That was cranial nerve 11. All her cranial nerves seem to be intact. Next thing we're going to do is your thyroid gland palpation. And we're going to use the posterior approach. I'm going to have you tilt your head slightly forward and slightly to the right. Perfect. And I am going to use my left hand to try and displace the thyroid gland and the right hand to palpate it. And I cannot feel anything, so this is normal and it's within normal limits. Next, we are going to palpate your carotids. One at a time. And those are within normal limits. Now I'm going to have you just scoot back and try and lay it like a 45-degree angle with your head back. This is just checking for jugular vein distension. And we're going to see if we even see any. In a healthy young adult, there probably isn't any. And there doesn't appear to be any. But if there was some, what we would do is we would go about where we see it, and we would stick something straight horizontally, and then we would measure about where we see it on the chest. And anything under 2 centimeters is considered within normal limits. When it comes to the otoscopic exam, I don't have an otoscope, but what you would use is the largest speculum that fits in the ear. You would have the patient tilt slightly away. You would pull the pin up and back, but you would pull it down if the patient was under 3 years old. And you would hold the otoscope upside down. And it appears that the external canal of her ear is within normal limits. And if you were looking at her tympanic membrane, it should be shiny pearl pearly and gray. Next, we are going to palpate her frontal sinuses above her forehead, of which feel within normal limits. And we are going to palpate her maxillary, and these are next to the nose, and they feel within normal limits, no swelling. This completes the HEENT examination, and next we will do the abdominal assessment.